Mama. Say mama. Yeah.
I don't know how to tell you this, but I'm almost 2 now and still not responding. That's one sign of a communication disorder, and delaying treatment can affect my development.
Many parents aren't aware of the early signs of speech, language, and hearing disorders, yet early detection and treatment can improve quality of life.
Say dada.
Ugh, here we go.
Identify the signs of communication disorders.
It's very important that as adults around children, we know the signs for hearing loss. So some of the signs for hearing loss in children include when a child is not alert to sounds. So between birth and 3 months, there's not very much that children do because they're still so small. But if the hearing is fine, they will be alert to sound. So when there are footsteps or when mommy walks into the room or something falls on the floor, they will react to that somehow. But if they're not showing any kind of alertness to sound, that could be a sign for hearing loss. If the baby does not respond when you call their name, so between the ages of 7 to 9 months, typically babies are aware of their names and they make some kind of response when you call them. They look at you, they turn. But if this is not happening, just be aware that maybe there might be a hearing challenge. If the baby does not respond to simple directions like fetch your book or wear your shoes or fetch your shoes, simple things like that, they should be able to engage with those and follow such simple directions. And this is typically between 13 and 18 months of age. If the child shows any delay in speech and language development, as we've seen in the previous video, where at the age of 2 the baby struggling to say mama and dada, so that is definitely a sign that the speech and language development is delayed. If that is the case, anywhere between birth and 3 years of age, you definitely need to know that that could be a sign for hearing loss, because hearing has a direct impact on speech and language development. You need to hear in order to learn to speak and use language. If the baby pulls or tugs at their ears a lot suddenly, this could be a sign that maybe the ears are painful, or maybe there's an infection developing in the ear. Also, in the early stages of an ear infection, the baby could scream and cry, which is just indicating that there is something that is irritating them in the ear, and we need to look and see what's going on inside. If the child has difficulty achieving academically, especially in reading and math, remember we said hearing is critical for speech and language development, but language development is critical for learning to read and write, especially for meaning. Because when you're teaching children how to read and write, you're obviously using a lot of language and you're relying on the inherent language within the child. But if there's hearing loss, obviously the language will be disrupted, and therefore the reading and writing, especially for meaning, will be disrupted, as well as maths as well. In South Africa currently, the research findings on reading and writing for meaning are not looking good at all. The findings from the reading panel are suggesting that 82% of our grade 4 learners cannot read and write for meaning in any language. And what's important to note here also is that vision and hearing are identified as enabling conditions for reading and writing for meaning. What this means is that children need to hear the sounds in order to sound them out and read them. They need to be able to see the sounds in order for them to read them. So it's quite important that in cases for some of our learners that are struggling to read and write for meaning, that we also have a look and check that the enabling conditions such as vision and hearing are intact. Also, children with hearing loss will struggle with social interaction as well as just general unhappiness at school. Remember, hearing loss is a communication disorder. And so if you're unable to communicate with your peers, you're unable to communicate effectively with the teacher, it will create a sense of unhappiness and also just general social isolation. So if you're noticing any of these signs in children, in your classroom if you're a teacher, or you're noticing these signs in your child if you're a parent, please take action and take the necessary steps that we get to the bottom of why this is happening. So now we've gone through the signs for hearing loss, but what can you do if you are concerned that maybe your child has a hearing problem, or maybe you're a teacher and you have a child with hearing loss? First of all, you want to make sure that you see an audiologist if your child did not pass the newborn hearing screening. Newborn hearing screenings are not universal in South Africa, but there are many hospitals that do offer this service, and sometimes even at the clinic where the audiologist from a hospital will visit a clinic and come and do some hearing screening on babies. So if the baby has failed this test, please make sure that you do not default, in that you don't follow up to make sure that an audiologist sees the child and does the follow-up assessments, just to make sure and check what is happening. If you have an older child and they fail the school hearing screening, please make sure that you also see the audiologist so that diagnostic assessments can be done. School screenings can be done by nurses, they can be done by audiologists in many settings as well. And sometimes somebody that is trained to do hearing screening could do the screening. But if you get a report that the child has failed the screening, please make sure that you follow up with an audiologist so that diagnostic testing can be done. You also want to see an audiologist if you have any concerns about your child's hearing. So in some instances, hearing loss can begin months or even years after birth. So you want to make sure that if you are concerned at all, that you definitely see an audiologist, because some of the tests are really quick and simple, and you will walk away knowing exactly what's going on with your child's hearing. You also want to see an audiologist if your child reports hearing a ringing or a beeping sound in one or both of their ears. This condition is called tinnitus, and it is a sign for hearing loss. And if a child is saying that, they're hearing this thing in the ears and you are not hearing anything, so they're hearing it inside of themselves kind of thing, you want to definitely act on that and mention it to the audiologist, and they will do the necessary tests to check what is happening. You also want to see an audiologist if your child reports any changes in their hearing. So this is more for like the older kids, where they did have a hearing screen at some points and everything seemed fine, but after some time they say that they feel as if like the hearing is a bit muffled, people sound a bit softer or anything like that. You definitely want to follow that up and go and see an audiologist to check what is happening in the child's ear. If your child now is diagnosed with a hearing loss, you want to make sure that you ask the audiologist if they qualify for hearing devices. And hearing devices include hearing aids, which can be that small. They're typically not very big. They sit behind the ear, like that, and sometimes there could be like an extra strapping there just to make sure that the hearing aid doesn't fall off. So it sits behind the ear, and all it does is it picks up sounds that the child is unable to hear. You also want to find out if they could benefit from a classroom listening device, and classroom listening devices are known as FM systems. And how they work, it's a two-part device. So the teacher wears a device, and that device is programmed to the hearing aid, and it helps the child hear better within sometimes a noisy background situation. So typically classrooms are actually very noisy. There's a lot of background noise, there's lots of shuffling of chairs and children chit-chatting and so on. And even in the most ideal classrooms where the children are not rowdy and making a noise, but it can still be difficult for a child with hearing loss to fully hear and understand what the teacher is saying. So what this FM system does is that it takes the teacher's voice and directs it straight to the hearing aid, so that the child hears the teacher as if the teacher was right next to them. So it's a very wonderful device that children with hearing loss definitely need. We've gone through the signs for hearing loss. It's important to know that the earlier you seek help for a communication disorder, the better. So now you know the signs, it's important to act quickly. Act today. Don't forget to like and share with others that you think may benefit from learning more about hearing loss.